How are testicular germ cell tumors monitored? Testicular germ cell tumors, or GCTs, are monitored through a careful blend of clinical exams, blood tests for tumor markers, and imaging studies. This approach helps doctors detect any recurrence, assess how well treatment is working, and identify if the cancer has spread. The monitoring plan is customized based on the type of tumor, its stage, and the treatment the patient has received. After the initial treatment, which often involves orchiectomy, the surgical removal of the affected testicle, patients will have regular follow-up visits. During these visits, doctors will take a detailed medical history and perform physical exams. They focus on spotting any new masses or symptoms that might suggest the cancer has returned. If a new mass is suspected in the remaining testicle, a testicular ultrasound may be performed. Serum tumor markers play a crucial role in monitoring GCTs. The primary markers include alpha-fetoprotein, beta-human chorionic gonadotropin, and lactate dehydrogenase. These markers are particularly helpful in detecting any residual or recurrent disease, especially in non-seminomatous tumors. However, it is important to note that up to 35% of relapses can occur without any elevation in these markers. Therefore, testing for these markers is especially recommended for advanced seminomas and all non-seminomas during follow-up. Imaging studies are also essential in monitoring. Computed tomography scans of the abdomen and pelvis are typically performed at regular intervals to check for recurrence, especially in the retroperitoneal lymph nodes, which are the most common site for metastasis. If there are concerns about lung metastases, chest radiography or chest computed tomography may be used. Magnetic resonance imaging and positron emission tomography scans can be utilized selectively, such as when contrast computed tomography is not an option or in specific situations, although the routine use of positron emission tomography in surveillance is still being evaluated. The frequency and duration of monitoring can vary, but it generally lasts for at least 5 years after treatment. Most recurrences for seminomas happen within the first 2 years, while non-seminomas may recur within 6 months. Follow-up protocols are tailored based on individual risk factors and the initial characteristics of the tumor. In summary, monitoring testicular germ cell tumors involves regular physical exams, blood tests for tumor markers, scheduled imaging studies, and ultrasound for any suspicious findings. This thorough approach allows for early detection of recurrence or metastasis, which is vital for guiding timely treatment and improving outcomes in reproductive cancers like testicular cancer. Always consult with healthcare professionals for personalized medical advice and to ensure the best monitoring plan for your situation.